am Michelle Jane Sevilla, and today I am going to perform female urinary catheterization. Urinary catheterization is the insertion of a flexible tube or catheter to the urethra into the bladder to empty it of urine. Catheterization reduces the risk of infection and kidney damage by emptying the bladder either continuously or at regular intervals. This procedure is done when people are having difficulty urinating naturally or even before or after a surgery when necessary. So prior to the conduct of the procedure, I will check the doctor's order for catheterization to ensure that I have the right patient and the right procedure to be done. Next, I have performed hand washing, but I will perform hand hygiene to deter the spread of microorganisms that causes disease and contamination. Now I have prepared the necessary equipment that I need, which includes a two-way Foley catheter, urinary bag, and my catheterization set. So good morning, ma'am. I am Michelle Jane Sevilla, your student nurse for today, and may I see your wristband, please? Alright, can we state your name and your birthday? Okay, thank you. So ma'am, today we will be doing a catheterization. We understand that you are having difficulty urinating, and so the physician has ordered a urinary catheterization for you. So basically, I am going to insert the tube through your urethra and connect it to the bladder so that you can excrete your urine. So during the procedure later, I will be exposing your genital area and you may feel uncomfortable. But afterwards, you should feel relief. Will that all be fine? Okay, thank you. So, do you have any further questions? Okay. So, we'll be fine if I close the door for your privacy and so no one will be able to disturb you while we're doing the procedure. So now position the patient in a dorsal recumbent position with knees flexed for good visualization of the meatus, where we will introduce the catheter. Also, gravity will aid the flow of the urine when the bladder is higher than the end of the catheter. And drape the patient, exposing only the area to be used, which is done to avoid the patient from getting embarrassed and having chills, which causes tension, which may interfere with the easy insertion of catheter. Okay, so now ma'am, I'm going to expose your cranial area, okay? Next is to provide direct light for visualization of genital area. So now I am going to open the tray set and arrange the equipment accordingly for convenience and to maintain sterility. Now I am going to open the tray set and arrange equipment accordingly for convenience and to maintain sterility. So inside of my tray, I have an eye sheet, sterile gloves, sterile cotton balls with a cleansing solution. A pre-filled syringe contains 10 cc of sterile water, which I am going to use to inflate the balloon of the urinary catheter. I also have a sterile forceps and a lubricant. So now I am going to add my catheter into the tray set. So this time I'm going to secure the urinary bag on the patient's bed frame. It should be below the waist level of the patient. So this time I'm using the sterile forceps to pick up the cotton balls soaked in a cleansing solution and clean the genital area of the patient. So from the mons pubis down to the anus. From the mons pubis to the labia majora of figure 7 down to the anus. And also on the other side. And now from the mons pubis down to the labia minora of figure 7 to the anus. And also on the other side. So after doing that, I'm going to perform hand hygiene and I'm going to get my gloves done. Now place the drape or pad underneath the perineum and grab the eye sheet and place it on the patient. Now place the sterile tray with the catheter between the patient's legs. Now I am going to take the catheter out of its package and lubricate the catheter about 1.5 inches. This is done to reduce discomfort and friction during the procedure. So now, attach the pre-filled syringe of still water to the balloon port but not inflating it. So next, I'm going to pick up the catheter at least 3 inches from the tip of the thumb. Place the thumb and one finger of the left or right hand between the labia minora and separate and pull up gently. So ma'am, I'm going to insert the urinary catheter, so just please relax, okay? So insert the catheter into the meatus for 2 to 3 inches or until the urine begins to flow, then advance an inch or further a little. So the female urethra is about 1.5 to 2.5 inches, and relaxation of the external sphincter aids in easy insertion of the catheter. So if a specimen is to be collected, pinch the catheter with the thumb and finger while placing the specimen container in position, because the urine will flow out of the lumen is not occluded. To rest the hand in the pubis area while holding the catheter in place to avoid pulling and pushing of the catheter, because withdrawing and pushing it back in the urethra may increase contamination in the urethra. So now inflate the balloon with 10 cc sterile water, so the balloon will prevent the catheter from slipping out of the patient's body. And remove the syringe quickly after the balloon is inflated. Pull gently on the catheter. Okay. So now connect the catheter to the urine bag, making sure the bag is closed to avoid leakage and maintain sterility of the connection. Secure catheter to the inner thigh by taping it, allowing enough slack to prevent tension, and remove the eye sheet. And also, I am going to take off this pad. And remove gloves after. So now, ma'am, we're done. I'm just going to cover you up. So, ma'am, do you feel comfortable now? Alright. So now, document procedure according to agency policy, including the date, time, size of catheter, and amount of fluid used. So the procedure was done today on August 26 at 1 p.m. I used a two-way Foley catheter. Its size is 12 French. Also, I used 10 cc of sterile water to inflate the balloon, and also record the patient reaction and response to urine output, including its character and amount, and also any significant observations. So now I am done performing catheterization, and that's it for this video.